So health literacy is about a person's ability to work with information and services, but also tells us really important information about our health services. To what degree can they look after the people in our community, irrespective of their skills and interests and abilities to understand health information? Health literacy has been studied in all continents of the world now, particularly in America and in Europe and in Australia and Canada, lots of great places. And what we've found is that health literacy is linked to poor health outcomes. People unable to self-manage as well as they should, people unable to find the right health care. So people with low health literacy are less likely to have good health. So health literacy is a really important thing to consider to improve and understand our health services. We need to take notice of it, because if we don't, our service will keep providing good health care for people who are well off and well educated, but not providing good health care for people who aren't so well off and don't have a good handle on health care. In Ophelia, we've taken a person-centred approach and a clinician-centred approach and an organisation-centred approach. We've decided we need to consider all parties in the system. So by understanding the health literacy of people and the health literacy responsiveness of our organisations, we can then have a better chance to understand how do we need to improve services and systems such that all people have a very fair chance of getting health. So health literacy is, as we do in Ophelia, is really quite different, because we have a very systematic approach that gives us detailed information about a person's strengths and weaknesses across a whole wide range of areas. The development of Ophelia came from 15 years of research where we had developed quite a few healthcare innovations. Some were implemented beautifully into the healthcare system, improving equity and outcomes. Others didn't go so well. So part of Ophelia is really understanding how can you produce for the community really meaningful interventions to improve people's chances of health. Ophelia was developed so that we could have a framework to support clinicians and organisations and governments to work out how best and systematically can we serve our community. So Ophelia is built to be a system framework, a health literacy response framework, to give us the best chance of efficiently improving healthcare and improving health equity. The Health Literacy Questionnaire, the HLQ, is a really important innovation. It's a needs assessment. It gets in and works with ordinary people to get a profile of their health literacy strengths and weaknesses across 9 areas. If we can understand people's strengths and weaknesses and why they have these strengths and weaknesses, we can begin to develop interventions that can improve health systems and health capabilities of individuals. Measuring health literacy by organisations is a really important opportunity to see how well the organisation is doing. So if an organisation got some feedback that people are having trouble understanding and accessing services, or having trouble being motivated, or they're finding it hard to talk to doctors, or they don't really have good abilities to talk to doctors, or they don't have the ability to really understand the health information that they're given. So if we get fine-grained detailed information about a person's health literacy profile at the organisational level, they can think, wow, are we really serving our community or not? It does happen in hospitals now and again that there's mistakes. And we need to find out whether this mistake is a person or patient-related mistake, or it's an organisation or a healthcare system mistake. If we can get to the bottom of that, we can find out how to improve it. So it's about quality improvement and service and systems improvement at the organisational level. The thing I'm most proud about with Ophelia is that it's given many organisations and researchers and practitioners an insight into their own worlds, the degree to which their patients really enjoy and like their services, but also provides really honest advice. It provides the patient's voice, the consumer's voice, the citizen's voice in a way which we haven't ever heard before. I think I'm most proud of Ophelia that it provides the voice of the ordinary consumer. It's able to put on the table the voice of the most disenfranchised, the most weak and fragile person. Those people's voice is the same as the voices of executives, senior people, doctor. I'm so proud that Ophelia and our collaborators are able to put together a program which enables health services improvement, which forces equity into the system. Ophelia has been developed by a really terrific team of people. Roy Batterham is a physiotherapist and program evaluator who's deeply, deeply concerned with health equity and really great methods. Rochelle Bookbinder, a rheumatologist who is so sensitive about patient information and about systems and measurement. And a whole range of people who really care that we can produce research that's not just for publication, but research is for good improvement and effective and easy improvement of services and systems.